FaceRehab. Podcast series.
Welcome to FaceRehab, the facial palsy road to recovery. I'm your host, Veronika, and I'm excited to introduce our guest, Catriona Neville, again. Catriona is a highly experienced physiotherapist specializing in facial palsy, bringing over 2 decades of expertise to her practice. She operates within the specialized facial palsy clinic at Queen Victoria Hospital and serves as the chair of Facial Therapy Specialists International, contributing as a member of the Medical Advisory Board of Facial Palsy UK. In addition to her clinical work, she leads support groups, providing invaluable guidance and support to those affected by facial palsy. In this episode, we delve into the second stage of facial palsy known as the Paresis stage, where subtle or partial movement starts to emerge. Join us as we discuss essential guidance, effective facial retraining, and a valuable advice to navigate the rehabilitation process during this phase. Also, if you are interested in learning more about the first phase of facial palsy, flaccid paralysis, we recommend listening to the previous episode.
Facial palsy. Road to recovery.
Welcome back, Catriona. We are grateful to have you back on the podcast, sharing your valuable expertise in this specialized field, with a particular focus on the second stage of facial palsy today, known as paresis.
Thank you so much for having me back, Veronika. It's really nice to have the opportunity to talk about paresis today.
Last time we discussed the first stage, the flaccid paralysis. Could you provide us with further insights into the paresis stage? What are typical symptoms that individuals might experience during this phase?
Well, paresis is the second phase of recovery from facial palsy. So we typically use paresis to describe when a patient is starting to get a little bit of movement back into their face, or maybe even just a little bit of tone in the face. So normally when the nerve is working correctly, the brain is sending constant signals down the facial nerve to the facial muscles, and the facial muscles have a continual bit of muscle tone in them, which is what keeps them in the correct structure and stops them being paralyzed all the time. So when we start to see that tone coming back, we know that patients are entering into the paresis stage, and we might start to see a few flickers of movement. Now, because of the way the nerve regrows or regenerates as it recovers, usually we'll see the first signs of recovery in the cheek or eye area of the face, because this is closest to the recovering nerve. And then other areas might improve later on. However, some people can have a mix of different types of nerve injury, so they may have a different pattern of recovery, which is why it's so important that everyone gets an individualized specialist facial assessment and management program, because no two people are the same. So it's difficult to always predict what might happen, but generally we'll see people starting to get some early recovery of movement back and an improvement in their facial tone, so their face will be less floppy overall.
So, in paresis stage, movement is starting to emerge. What exactly happens physiologically in the face when this process begins?
Well, when facial movement begins to happen, generally patients can have some stiffness in their face already due to the period of time the face hasn't been moving. So what can happen when movement begins is that the face is trying to overcome that stiffness and can work too hard as a result of that. So one of the things we do notice is that patients who've had facial palsy have a tendency towards overactivity and the muscles being too active, too strong after facial palsy, rather than too underactive and too weak. So we don't really worry about people not being strong enough or not being active enough. We worry about them being too active, working too hard, being too strong. So that's one of the changes we would see happen when movement begins, is potentially over effort, trying too hard, either because people are excited to see movement back in their face, which is completely understandable, and tend to rush to the mirror and try to move their face over and over and over again, and overwork it in that way, or because they have some stiffness in the face and it's just difficult to get the face moving beyond that stiffness, so they have to work too hard in order to overcome it. We also see that sort of difficulty in balancing the two sides of the face. So we've talked in a previous podcast about the unaffected side of the face can become overactive whilst it tries to compensate for the affected side not working at all. So now we have the affected side starting to work a little bit again. The unaffected side has got used to overworking. So there's this difficulty in trying to rebalance the two sides of the face that would have previously worked in harmony together and now are sort of working as two individual halves of a whole. So we need to restore that coordination of the two sides of the face. So that's generally what we would see, but we will see changes in the tone of the face. So the things to look out for is perhaps the eye not looking as wide. So as the muscle tone returns to the eye, it doesn't look so wide and starey. The corner of the mouth might not look as dropped. The nasolabial fold, which is the crease in the face that runs between the edge of the nose and the corner of the mouth, that tends to disappear when people are paralysed, and we might see that start to come back as the tone of the face improves. So these are all signs that people are entering into the paretic stage of their recovery.
Trina, what specific recommendations do you have for individuals in this stage when there is a slight or some movement already?
So a lot of the recommendations stay the same in the paretic phase as they are in the flaccid phase, which is in particular to keep movement, if there is some, very gentle. Try to balance the left and the right side. Don't let the unaffected side take over and be massively overactive. Equally, don't try and move the affected side excessively. So don't go to the mirror and try and move your face over and over and over again. You're not going to be able to force additional movement to come back. You've got to wait for all those nerve fibers to recover, and then the movement will gradually come back online and can be retrained under expert supervision. So I think it's often about what to avoid doing as much as what to actually do. In this stage, it's important to continue to look after the eye. So the eye closure may still be reduced. The blink may be incomplete, reduced in frequency. So the eye is still going to be stiff potentially and unable to protect itself. So all that advice on eye care, protecting the eye with eye coverings, taping the eye at night if necessary, using preservative-free eye drops or eye ointments or lubrications, that all needs to continue in the paretic stage unless patients have full, complete eye closure. So that's really important. Also maintaining the mobility of the tissues. So it's great if some movement's coming back, but we want to make sure there's no stiffness or tightness in the muscles. So starting to compare and contrast the unaffected side with the affected side, seeing if there's stiffness in the affected side that isn't there perhaps in the unaffected side. So trying to work out what does normal feel like. And sometimes you will have never thought about that until you've had a facial palsy, because our face is just something that works without us having to think about it. But suddenly we're having to actually think, gosh, what is a smile? Where does a smile come from? What muscle creates a smile? And there's a lot of misconceptions that people have about their movement. So the facial muscles are attached to the skin of the face, and when they contract, they move the skin in 3 dimensions. So if we take the smile as an example, we actually smile with our cheeks. So the smile muscle is up in the mid-cheek area, and when we smile, our cheek flexes and creates like a cheek ball, and then that pulls on the skin, which raises the corner of the mouth. But over the years, when I've asked patients, where do you think your smile muscle is, they'll often point to the corner of their mouth, because that's where the eye is drawn to when you look in the mirror. And that's why I really never recommend working with a normal mirror to my patients, because your eye will be drawn to the area of your face where there isn't actually muscle activity happening. And that can actually make your brain try and bring in the wrong muscle groups, which can make the movement harder for you rather than easier. So education is really key in terms of understanding how your face actually works, not how you think it works, but how it actually works. Learning about all the different muscles of the face, how they work, where they attach to the skin, what direction the skin moves in. And I often say to my patients, you need to become a bit of a facial expert yourself when you're recovering from facial palsy, because what would be great is if the muscles just came back on board online and just worked as they did before. And for some lucky people, when they've had a quick recovery, this is pretty much what happens. But for anyone who's had a longer recovery, it's sadly not quite as straightforward as that. The muscles actually need retraining. The brain needs to learn how to reconnect to those muscles appropriately again. And it's a bit like learning to move for the first time all over again. And that really needs someone expert to guide you. So again, it's finding someone experienced and specialist in facial therapy who's really had a lot of experience, who's done a lot of training, who can help guide you and educate you through this process of the muscles coming back on board and coming back to life, and help you with that recovery.
So, you said it is important to know what not to do. Can you explain that in more details? Give us some examples.
The most important thing to avoid is overworking the face. So, as I've said before, the temptation is to see what can I do each day and how much can I get my face moving. But actually, overworking the face is going to cause potentially significant complications in terms of synkinesis, tighter face muscles, and that's going to delay the recovery process at best, if not worsen the prognosis of how much you can actually improve. So definitely important to avoid overworking the face, trying to force any movement. That's not how our face works. So I always say to people, think about facial movements. It's incredibly gentle, light, effortless. So the last thing we need to do is try and force the face to do strong, effortful, big movements, because that's not what it does on a day-to-day basis. So we don't need to practice that. So avoiding over effort, avoiding a lot of the things I've recommended in the previous podcast to avoid. So things like electrical stimulation, which can increase the risk of synkinesis. Just avoiding all those odd treatments that tend to get recommended on YouTube and Facebook. If something hasn't been recommended to you by a specialist in facial therapy or a specialist practitioner who really understands facial palsy, then I would definitely avoid it, because a lot of those things can actually end up leading to complications or delays in the recovery process.
And how long typically does the paresis stage last? And are there proactive measures individuals can take to speed up their recovery process?
So the paresis stage it can last for varying amounts of time, depending on how badly damaged the nerve was at the time of the facial palsy occurring, how long there was pressure on the nerve, how many fibers of the nerve were damaged, for example. So as I said in the flaccid paralysis podcast previously, we can sort of split patients into two groups. The group that make a fairly swift recovery within weeks rather than months, and then the patients where recovery will be months rather than weeks. So in the former group, where recovery is within weeks, then the paresis stage will kick in generally quite quickly within the first 4 weeks, generally, where they'll see some movement coming back. And that will last until they're fully recovered, which is generally sort of anywhere up to 12 weeks, with a bit more movement coming on day by day as the nerve fibres come back online, so to speak. With the patients where recovery is going to take months, then the paresis stage is going to last longer and start later. So it wouldn't be unusual for someone to be in the flaccid paralysis phase for up to four months, maybe even a little more, and then start to develop paresis. And potentially for that paresis phase to last long term, it can sometimes be difficult to pick apart paresis and synkinesis. When patients start to develop synkinesis, what happens is that multiple muscle groups work at the same time and they create a tug of war against each other. And that tug of war can result in the face not moving on the surface, even though there's a lot of activity happening under the surface in the muscles themselves. And so people who aren't experts will often mistakenly think that synkinesis is paresis. So it can be hard to pick apart because they can look very similar. But the paresis stage is generally when the movements are coming back online, the tone is starting to come back in the face, but hasn't started to get too tight, hasn't started to over-recover yet. That would be the point where we would say patients were tipping from paresis into synkinesis, when they start to get particularly tight in the muscles, when they get tight in the face, and we'll cover that in more depth in the paresis podcast that we're going to do together. But in terms of being proactive, speeding up the recovery process, again, it is a matter of allowing the nerve to naturally recover. We can't speed that up. What we can do is keep the muscles supple and mobile through massage, gentle trigger point release, gentle stretching as required, which will help so that when the nerves do come back online, the muscles are in a healthy state in order to allow movement to occur. So the brain sends the message down the nerve, or down the few nerve fibers that have recovered. The muscles receive that message and are able to respond because they're not sort of stiff and out of action as a result of that. So that's the best way people can not speed up the recovery process, but improve their ability to move as the nerve recovers, is really by keeping the face nice and supple and healthy as the nerve recovers.
Could you tell us more about why the exercise is beneficial at this stage and why it should be symmetrical and gentle?
I don't tend to think of it as exercise, because to me, when I think of the word exercise, I think of working hard, perhaps working in a gym, perhaps running, all of those things which are really quite hard work and might take quite a lot of effort and strength to do. And moving the face is the opposite of this. It's really gentle, it's really effortless. So I prefer to think about this as retraining rather than exercise. So I would say facial retraining is beneficial at this stage, because the facial nerve has been offline, it's starting to come back online, the brain is starting to send messages through the nerve to the facial muscles. But the facial muscles have forgotten how to interpret those signals correctly and create the correct movements. So starting to pay attention to how we move on the unaffected side and where the muscles are, how they function, what three-dimensional movements they move in, how that feels, and starting to apply that to the affected side where there is movement just starting to come back, and working on getting that symmetry and precision, coordination back into the face is what's beneficial at this stage. It's helping the face to interpret the signals from the brain appropriately, helping the brain to actually send the correct symmetrical, coordinated signals from the brain. That's what's important at this stage, alongside making sure the face is in a healthy state so that when those signals come in, the muscles can respond appropriately. But we never want to force movement, in part because that would encourage other muscles to kick in that wouldn't normally come into those movements, and in part because that will create an imbalance between the two sides of the face, which isn't how the face would normally work either. So we need to keep the movement symmetrical. We need to keep it gentle because that is how the face works. So we want to be retraining something that is appropriate to how the face would work normally, not a different way that the face wouldn't normally work.
Then, what type of facial retraining would you recommend is the most beneficial?
Education, first and foremost. So learning about all the different muscles of facial expression. Where are they? What do they attach to? Which bit of skin do they attach to? When they contract, what direction does the muscle move in? And how being inquisitive on the unaffected side as to how that feels when that muscle moves. What does it feel like? What direction does it move in? How strongly does it move? Starting to actually be inquisitive about what your face does normally, because it might not be something you've ever thought about in your life before, because before you had facial palsy, your face just worked. You didn't have to worry about it. It just did what you wanted it to do without any thought at all. And now it's something you're having to retrain and think about and analyze and understand and be educated about. So first of all, just being gently curious about how your face works on the unaffected side. So as you start to educate yourself, learning about the anatomy of the face, learning about the physiology of the face, the way it moves. And you really do need an expert to help guide you on that. It's really difficult to unravel on your own because it's extremely complicated. There's 23 muscles on each side of the face on average, and our face is capable of doing thousands of different expressions with these different muscles. So it's not straightforward. It's not like if you get a knee injury, you just have to get the bend and straighten of the knee back. It's really a lot more complicated in the face because there's so many dimensions the face can move in. But as a general rule, there are certain things that most patients want to work on more than others. So it's uncommon that someone comes into my clinic and says to me, I really want to be able to raise my eyebrows as my first goal. Whereas a lot of people will say, I want to work on my smile or my eye closure or perhaps my lip seal. So that's often where we would start with just really gentle, symmetrical movement retraining. So we would start with educating patients about how the movements happen, where the muscle is that does the movement, where they should be feeling movement or directing their brain's attention to creating movements, and then learning to gently activate that movement, trying to regain symmetry between the two sides, and also learning to relax as well. We take relaxation for granted normally. If we're not doing something, we assume we must be relaxed. But actually, after facial palsy, it can be something that's really difficult for people to relearn and retrain the ability to relax the face. I think the best way to think about it is the face is a little bit scared to relax. It's been paralyzed and it's been trying to pull itself up desperately for potentially a couple of months. And then you tell your face to try and move and then to try and relax, and it's scared, subconsciously scared that if it relaxes, it will drop into a paralysis again. So there's a lot of subconscious reassurance that needs to go on, reassuring the brain that it is okay to relax the face, that it doesn't mean the face will become paralyzed again. And that differentiation between activating the face and relaxing the face is really important to restore. Otherwise, you can end up with a face that's just activated and turned on all the time and never actually relaxes. There's no differentiation between the two. And that's when the potential overactivity can really kick in. So in terms of retraining, most beneficial is very gentle, exploratory retraining, thinking about how the face moves on the unaffected side, trying to almost mirror that on the affected side. But most of all, it's that education and understanding about the face that's going to be more beneficial than anything else.
To explore this further, why is it not a good idea to try to strengthen up the muscles that have started working?
So, as I said before, it's pretty common that people think when there's been a problem in their body or an injury or something like the facial palsy that they need to get the strength back. And it's perfectly understandable, because throughout life, when we have injuries to our body, it is really important to get the strength back. If we've had a sprained ankle, we have to strengthen up our leg. If we've had a broken leg, we have to strengthen up the muscles around the hip and the knee. If we injure our elbow, we have to strengthen up our biceps and our triceps. But the face is completely different to the rest of the body. So the temptation is to try and apply the same rules to the face that we apply to the body. But the same rules just don't apply. So we don't need strength in our facial muscles. We're not trying to lift heavy shopping or heavy suitcases with our face muscles. We're just trying to display our emotions, our feelings with our face. So the muscles themselves are actually structured differently to the muscles in the rest of our body. There's a completely different structure to them and a completely different way that they work. So we don't want to try and strengthen them in the way we would strengthen our body, because we're not asking them to work in the same way we're asking our body to work. So if we try to strengthen the muscles in the face, and we do really forceful movements with the face is then working at a level way above where it would normally work. And that's going to make the muscles overactive, tight, and that's then going to make movement difficult, because a muscle that's short and tight can't activate gently and normally. A little bit like if you imagine if you had run a marathon, the next day you'd be walking quite stiffly, your muscles might be quite sore. And then if I said to you, right, now we need to do a ballet performance, you would say, oh, my muscles are really stiff and sore because they've been working so hard from running the marathon. I can't be very gentle and graceful and delicate to do a ballet performance. So it's a little bit like that analogy. If we make the face muscles too strong, too tight, then they're incapable of being delicate and graceful, which is what they need to be on a daily basis.
Why can in some cases the face still feel stiff and tight, even though it has been paralyzed?
Well, when the facial muscles haven't been moving for a long period of time, the fibers themselves can get stiff just through disuse. A bit like if you were to sit in a chair and not move for 3 months. If I then came along and said, right, jump up and do some nice gentle movements for me, you would say, gosh, I can't, Trina, I feel very stiff and my muscles all feel tight because I've been sitting in the chair for 3 months. And it's exactly the same in the face. If it's been paralyzed, it hasn't been going through its normal contraction and relaxation, which would normally be happening on a continuous basis throughout the day as we use our face to respond to other people's faces. So that lack of movement can actually lead to a lot of stiffness and tightness throughout that paralyzed phase. And that all has to be resolved so that as the face starts working again, those gentle, normal, effortless movements can come back, as opposed to the face having to work hard to overcome a few months of severe sort of stiffness from not being used normally. So that's why, even though it's been paralyzed, it can still be stiff and tight through disuse.
Eye care was indeed a significant topic during the flaccid stage. Do I still need to use eye drops, eye protection, or tape for my eye at night?
Well, this is variable depending on your individual presentation. So it's really important to have a proper assessment of your eye to see whether your eye is closing. It's impossible to tell yourself whether your eye is closed or not. I have many patients that come to my clinic and say, oh yes, my eye's closing. And then I take a photograph of them closing their eyes and I show them the photograph and I say, gosh, look how open your eye still actually is, even though you feel it's closing properly. And they're quite shocked to see that. So that's a technique you can use yourself. You can try taking a selfie photograph of yourself with your eyes closed to see if your eye is actually closed. Or if you have someone at home with you, you can try and close their eyes and ask them to have a look and see if your eye is still open a bit or not. But generally in this phase, the eye won't be closing fully. It won't be blinking normally. So in that situation, it's still really important to protect the eye. We don't want an eye abrasion, ulceration, potentially blindness to happen. So if the eye is still not closing properly, the eye is going to be more exposed. There's still going to be more evaporation from the surface of the eye happening. And even if you are creating tears, the blink mechanism is usually what takes the tears, washes them over the surface of the eye. I call it sort of the windscreen wiper. The eyelid is like a windscreen wiper washing tears over the surface of the eye. And when that's not working properly, the eye doesn't get fully lubricated. So that bit that's exposed can get really, really dry. So ongoing eye drops are a good idea until full eye closure returns. Protecting your eye is really important until full eye closure and full protective blink mechanism returns. And taping the eye at night remains important to not only protect the eye at night from getting scratched against the pillowcase or anything else that might get in your eye at night, but also to make sure that eye doesn't stiffen up from being partially open. So that overnight taping can actually give the eyelid a nice, gentle elongation and gentle stretch, making sure it doesn't stiffen up, and it will therefore work better during the day. So I recommend that all those protective factors for the eye continue until eye closure and blink are back to normal.
Trina, as we discussed in the previous episode and with a lot of information available, especially regarding treatments like exercising, electrostimulation, and acupuncture, what treatments are advisable and which one should individuals approach with caution during paresis stage?
Well, as I've said previously, Veronika, in our meetings and podcasts, a lot of the advice out there on the internet for people with facial palsy is unfortunately inaccurate, and it's misinformation that we wouldn't recommend. The problem comes because patients who have facial palsy that fall into the first group that recover within weeks rather than months, they do all sorts of wacky treatments. Because they get better, they assume incorrectly that it's the treatments they've done that have caused the improvement in their condition, when actually that's just the normal course of nerve recovery, and they would have recovered whether or not they had done those wacky treatments. So they then go on to promote these treatments to other patients, and other patients who are understandably desperate for help. they think, well, if that helped so-and-so, it must help me as well. And that's how we've ended up in this situation with lots of inappropriate advice being out there on the internet. But we have to be led by the research and our knowledge of how the face works. So what we know helps during the paresis phase is keeping the face supple and mobile, making sure patients massage their face and stretch any muscles that are starting to become tight, like the eyelid or the inside of the cheek, for example. And that we just educate patients about the way the face works, where the smile muscles are, for example, how the smile works normally, so that they're not trying to create a movement that isn't accurate as to how it would have been before. And it's very easy to get wrong because we don't learn to use our face when we're children. We mimic our parents and those people around us, and we learn to use our face at a time when we don't remember how we do that. So this is not something that's straightforward for people. It's something that they need really specialist guidance and advice on. So anything that's effortful, that creates big movements in the face should absolutely be avoided. And people should approach the retraining with caution, making sure that they are under the care of someone who has really clear understanding of facial palsy, of the different phases of recovery, of the workings of the face and the facial nerve, so that they can be carefully guided in the best way to manage their recovery. And we certainly would avoid any gross movements, strong exercises, things that work on strength. We avoid all of that because that's not how the face works. And we would avoid all types of electrical stimulation that can lead to an increased risk of synkinesis. So any electrical treatments, we would tend to avoid those. And we would use the treatments that are more research-based, or that there's more evidence for, including facial massage and movement retraining. So that's what we would encourage patients to work on at this stage.
Lastly, Trina, is there any empowering message or advice you would like to share directly with patients currently experiencing paresis stage?
What I would like to say to people at this stage is it's really fantastic that you are getting some recovery in your face. And just remember how important it is to stick to those rules about being really gentle with your facial recovery. As tempting as it is to go out there and use your face as much as possible, it's really going to do more harm than good. So please be gentle and find an expert that can guide you in your recovery. That's going to really give you the best chance of the best possible recovery from your facial palsy.
Again, thank you so much, Trina, for your shared knowledge in this podcast. In the next episode, we are going to talk about the synkinesis stage of facial palsy together. I want to also remind our listeners that they can find even more resources and support in FaceRehab mobile application and on our website, FaceRehab.com, where they can also book online video consultations with facial specialists. Thank you for being with us today, Trina, and thanks for sharing all of your tips and advice.
Thank you again so much for having me, Veronika. It's really been a pleasure to share my knowledge around paresis, and I'm looking forward to talking about synkinesis with you and how patients can help improve the situation if they're suffering from synkinesis. Thank you.
Facial palsy. Road to recovery.
If you enjoyed today's episode, please subscribe to our podcast and leave us a review on your favorite podcast platform. We also invite you to join the Bell's palsy and facial paralysis support group by FaceRehab on Facebook, where you can connect with others who are living with facial palsy and share your experiences. Thank you for joining us today, and until next time, take care of yourself and remember that you are not alone in your journey to recovery.
FaceRehab. Bring your smile back